friends. Warm welcome to our session on rotationplasty, a modified amputation surgery, a beauty in the eyes of Almighty. So, what is meaning of this? We will be subsequently seeing. So, what is meaning of rotationplasty? Why it is called modified amputation, and why I have used the term a beauty in the eyes of Almighty. So, thanks to Doc Plexus for inviting me for the session in their program. So this work has been performed at GCRI, Gujarat Cancer Research Institute, Ahmedabad, India. So greetings from GCRI. It's a 750-bedded cancer center, exclusive cancer center. It's a regional cancer center where all this work has been performed. So what is meaning of rotation plasty? So we are seeing this video and it's a kid who is moving his leg, foot upside down. So again, I'll play this video back again. So a kid with foot turned upside down and the ankle joint is working as a knee joint for this procedure. So it's not that great cosmetic procedure, what we see here. So is it still justified? Yes. So this is how the patient is moving his ankle, and we can see he's moving his both the knees joint, and this is his new knee joint. So the ankle joint is working as a knee joint, and here we can appreciate the limb is turned up, and this is the surgical scar which has healed very well. So this is how the patient is moving his hip joint. The hip joint is all okay, and this is his new knee joint. The ankle joint is a new knee joint for this patient. So this is how the patient uses his prosthesis. So this is how he is applying his prosthesis. This patient always requires a prosthesis, and it gives excellent function, and the patient walks very well. So he's attaching his prosthesis independently. It doesn't require any help of any other person, his parents. So he is able to attach his prosthesis. So this is a specially designed prosthesis. It's called a rotationplasty type of prosthesis. So this is how he has attached his prosthesis. He is moving his knee joint. So he's flexing his new knee. And this is his walking video. Walking independent ambulator. So here we can appreciate while walking, the new knee joint is formed by the ankle joint. And the limb is turned totally by 180 degrees. See that? So from the side, the ankle joint is working as knee joint for this patient. So what is meaning of rotationplasty? So we have seen the video of the patient is working and walking with his new ankle joint, working as a knee joint for him. So rotationplasty is a procedure where it converts above knee amputation. So this is very important term. Above knee amputation is converted to below knee amputation. So here it's a schematic video. So we'll be seeing what is this and how the limb is rotated by 180 degrees. So this is a small animation video. This was the tumor involving the femur bone. So we are cutting the tumor with good margins. So tibia and femur part is cut. And we'll have this much gap from after removing the tumor. So this is the neurovascular bundle that is saved. And this was the tumor which is resected. So after this, the lower part of the leg will be moved upwards, preserving the artery, vein, and nerve. And the limb will be rotated by 180 degrees. So I'll explain this procedure again. The tumor involving the femur or tibia. So here it's a tumor involving the femur, which is cut with good margins. So this was the margin which was taken. So this is the resected tumor. So we have to protect and preserve the artery, vein, and nerve. So that is preserved, and this tumor is resected. So The artery vein nerves are preserved. The limb is rotated by 180 degrees. So this is very important. Normally our foot is facing in front, but in this procedure you have to rotate the limb by 180 degrees so that the ankle joint will be working as the knee joint. The plantar flexion and the dorsiflexion gives similar movement like our knee joint if we rotate the limb by 180 degrees. So this is very important procedure. Preserve the artery, vein and nerve and rotate the limb by 180 degrees. And fix the distal part of the leg with the remaining femur, and the vessels are coiled. So there are chances that the artery vein now may get blocked. It can have clots. So this can be a known complication of this procedure. Thrombosis of the vessels. So there is the coiling of the vessels is done. Limb is rotated by 180 degrees and the leg is put upwards so that it is attached to the femur. So we can see here this much big gap. So the limb will be very short. It's a modified amputation. So yes. So we fix the lower part of the leg with the femur with the help of plates and screws. So this was the post-operative radiograph of the patient, and the tibial part is fixed with the femoral part. And this was the clinical picture of the patient. Next, we'll be seeing how the patient walks with this prosthesis. So he is able to climb upwards, climb the stairs, and go down along the stairs. So we have seen the walking video of another patient, and this is the patient where he is going up and down on the staircase, and he is removing his prosthesis. So this was the special prosthesis made for him. And here we can see the foot is turned by 180 degrees. So the ankle joint is working as knee joint for this patient.